Thank you. Just as a reminder, this is being recorded and live streamed. So by being on, you are giving consent to be recorded. And everyone, please mute your lines. Make sure you say your name before you speak. And all votes will be a roll call vote. And I'll go ahead and hand it over to you, Paige.
Great. This is Paige Toth, and I'd like to call this meeting to order. Can I get a roll call, please?
Paige Toth.
Here.
Candace Clevenger. Vivian Goodman.
Here.
Jan Hack. Dr. Jurger. Sue Krause.
Here.
Mary Jane Linton.
I see Mary Jane on there.
I'm muted.
There you go.
Muted, I'm sorry.
Dr. Meningati. Dr. Patterson.
Here.
Phil Tibbs. And Laura Zimmerman.
Here.
Okay, great. The agenda was circulated. Brandy, are there any changes to the agenda?
There are not.
Okay, can I get a motion to approve the agenda topics?
Laura, so moved.
Okay. I second.
Okay, can we get a roll call?
Paige Toth.
Approve.
Vivian Goodman.
Approve.
Sue Krause.
Approved.
Mary Jane Linton.
Approve.
Dr. Patterson.
Approved.
And Laura Zimmerman.
Laura, if you're on here, we can't hear you. Might be muted.
Approved.
Thank you.
Okay, Brandy, do we have any public comment this evening?
We did not receive public comment and no one is here in attendance tonight.
Okay, great. Next up is approval of the previous meeting minutes, which are in your packet. So if I can get a motion and second on that, unless there's any questions.
I move we approve.
Can I get a second? Okay. Roll call vote, please.
Paige Toth.
Approve.
Vivian Goodman.
Yes.
Sue Krause.
Approve.
Mary Jane Linton.
Approved.
Dr. Patterson.
Approved.
And Laura Zimmerman.
Approved.
It's Sandy. This is Candy. I'm on the phone.
Okay. All right. Thank you.
Okay, communication, Brandy.
All right, so just a couple of things this month. I'm going to actually flip the order. The first one is just our regular update for January as far as board education, and that's for succession planning, unplanned absence of the administrator. So that's just basically a reminder and an education piece for all board members that if something happened to me or I was out of work on an unplanned basis, if something, emergency happened or unexpected, that our assistant administrator, assistant administrator, Bethany Staple, who is always on the meeting, so you're probably very familiar with her name and face, she would actually be acting in the role as acting or interim administrator during that time. So if you have any questions, I'm happy to answer those. When we did do our last update of the personnel manual, legal did tell us that that didn't need to be in the manual since we did now have an assistant administrator when years ago they did not for a little while. So I just wanted to make sure you all know that so that if there was something unexpected that happened to me, we do have a succession plan and Bethany is involved or informed about everything that I do. So she would easily be able to step into that role in a very successful way. Any questions about that before I go to the next topic? And one other thing, she does have the same qualifications. Well, exactly the same identical wise, but as far as what the law requires for the position of administrator, she does have all of the requirements. And then she also does have that certified public health administrator, which is not required, but a nice thing to have. So she does meet all of those qualifications as well. So we would still be compliant with the law if she did have to step into that role temporarily or permanently. Okay, so moving on to COVID-19 updates. I know that we did meet last week with our emergency meeting, and thank you again to everyone who was able to join. I know I didn't give you a lot of time, and it was during the workday, so if you couldn't meet, we will get minutes out, and that live stream recording was posted immediately after that meeting, so you all can catch up if you would like. Just a few updates though, if you've been watching our positivity rate with COVID-19, it has been going down, which is excellent news. We were not in the metrics that were required to move out of tier 3, but there were some adjustments made to the metrics, if you saw that in the last couple of days in the news, which then did qualify us because of staffing availability increasing. So now we have been moved to tier 1. So that is on the IDPH website, and you can get information if you're looking for that for your own business, or if you've had members of the community reach out to you. Everything is broken down really nicely online so that you can find that. A few other reminders. I know when I was out, well, Kathy and I were out last week speaking at some of these meetings, there were some comments made that there's not certain data available from the health department. So I do just want to give some clarification to that. One of the things was potential location of exposure. That is available. It's on IDPH's website, and you can review it broken down by region. And then another thing that people were looking for was more region or county specific data and trend information. That is also all available on their website. We obviously don't have epidemiologists on staff. The state does, and that's great. So they're able to get all of that information out together and have it readily available to the public and updated on a regular basis. So we do always refer the community to that. And then, of course, we do our daily release with the information that we do have. So I just want to make sure you all knew that if you're being asked. Last week, like we had mentioned, we did go to some meetings to speak to City Council and then also the County Board about what they were possibly going to do. The City Council was considering making some changes to their ordinance for enforcement of COVID-19 regulations. They do have a meeting tonight. I'm not sure what they'll do now that we've been moved to tier 1, but we did go ahead and speak at that time. And then we did also speak at the EEHW and full county board meetings last week and encourage them not to go against the Restore Illinois plan that was based on data and science written by experts. The county board did ultimately end up voting to allow indoor dining with some rules. So yes, now we're in tier 1 and it's allowed, but if the numbers go in the wrong direction again, or if we do see any additional surges or anything like that, they have edited our ordinance like we talked about last week. So we still do not have the direction or the guidance that we want to have from legal before proceeding. We did not write the ordinance. We gave some input. I don't know that any of that was edited as far as additional input that we provided in addition to sharing the Sangamon County ordinance that they had developed. So we know what it says, but as far as being able to actually enforce it, we have not yet heard back from State's Attorney's Office. We did request a meeting to see if we could just chat through it so that we know how to proceed appropriately, and we haven't heard back yet. So we'll have more information for you all as far as that goes, but we're still, of course, providing that education and partnership if there are businesses that we get a complaint about or a business that reaches out and wants to ensure that they are following the rules and doing everything as safely as possible. We are being a support for them as much as we possibly can. So does anybody have questions about any of that so far? Okay, and then the only other thing I wanted to update you all on was what happened last week with our phone system. You might have heard some complaints. We've heard several. So I just wanted to give you some background so that if anybody does come to you, you know what happened. So as of, last week, we were still in phase 1, and we were told before that, the state will all move into phase 1B together to ensure that all healthcare workers are taken care of vaccination-wise before we move forward. We were also told there's a chance you may not get allocations in a given week because other counties may get it that don't have all of their 1A done. Well, then on Tuesday, we got something in writing that said if as a community we're ready to move out of 1A and into 1B, that we could go ahead and do that. And then that hopefully this week, the rest of the state could move forward, but the governor would put something out about that. So we did have our subcommittee meeting with our partners in the community and let them know what was going on. And then it just turned out that the next day, Wednesday, we, heard from nursing that they still had some 1A spots available that no one signed up for. So we knew we had spots open. We knew we had nurses down there ready to vaccinate, and we knew that we had vaccines sitting on shelves. So the decision was made that we would go ahead and open up those appointments to 1B, since we had been given that written permission, rather than sit on vaccine and let it sit on the shelves when we had staff ready and willing to vaccinate people. And obviously we want to do that as quickly as we can. So I said, go ahead, let's, open up. I'll take full ownership of the decision. Go ahead and open up the lines. Let's get those spots filled. I think it was irresponsible to let vaccines sit on shelves when there's people that are desperate and ready to get it. And so almost immediately after announcing that on social media, we had so many phone calls coming in on our lines that it kind of locked up our entire phone system, where we couldn't, not only some calls could not get through, but some people were being put by our system on hold and then disconnected. Some people couldn't get through it all and had a busy signal. Every line in the system was taken, so our staff couldn't even call out in any of the divisions in the building. And this is not something that's just specific to the health department or Macon County. This has happened in a lot of other areas, just because the demand is so great, the supply is so low, and the 1B population is very, very large. So there are probably in Macon County tens of thousands of people who were trying to fill a couple hundred or so spots. And so I will say the phones are not our long-term plan for filling vaccination appointments if and when we have them. There is a state program called M-Track that's going to be used that is an online platform that people can use to get registered online. There will still be challenges with that. Obviously, those spots are going to fill up quickly too. So there's still going to be a lot of people who are unhappy because they're having to wait longer if they don't get one of those first spots immediately. The other challenge is, of course, some people don't have internet, some people don't have computers, and some people don't know how to use them or don't want to use them in that way. So we will still have to, in some capacity, use our phone system, which we've historically not had any issue with. People don't usually get put on hold, for 45 minutes at the health department by any means. And our phone system just started automatically doing some of that. So Wednesday night as all of that was happening, we had a team and thank you again to all of you who did this, but we're up late into the evening working through logistics of figuring out not only rerouting our phone lines to our team's phone lines, which are these computer phone lines that we've talked to you all about that we have, but also utilizing our COVID, operator line to assist with this. Also getting more staff on to help return voicemails very quickly. And I think by sometime Thursday, we had over 800 voicemails in one box. And then people were calling different voicemails throughout the building just to try to get through to someone. So I can tell you, yes, it's a good sign that we have a lot of people that want to be vaccinated. However, this is going to be a struggle, not just in Macon County, but I think throughout our nation for a while until there is more supply for the great demand that we have. So we're doing everything that we can to have as many phone lines open all of the time as possible, and also have this additional online platform. We could have waited until the online platform was ready and pretty and packaged in a bow, but I felt like it was irresponsible to not get that vaccine in arms when we had it ready and we had staff ready to go. And so whether I feel like that was the right call, because that's people that got vaccinated maybe a week earlier than they could have. But I do realize there are a lot of people who are frustrated. There's a lot of people who are scared that can't get through. But I think this will continue to be an issue while we have thousands and thousands that are trying to get just few hundred vaccines. We do have other partners that are helping, the hospitals, the FQHCs. We are encouraging others to become eye care providers so they can help administer vaccine. We are encouraging doctors' offices. I know the state is helping encourage pharmacies to become providers. That's a process. They have to apply for that. It does take some time, up to weeks. And so hopefully more people will sign on to assist, or more entities will sign on to assist. But right now it's more of a supply demand issue than I think anything else. So we're just continuing to get information out to the public and to ask everyone to be as patient as they can as we wait for more supply. And we're pushing it out as quickly as we can as the health department. And I will tell you, as of last night, I believe it was, or yesterday afternoon, our team had checked and answered over 1,200 voicemails. And there are still more waiting, but we did think it was important to get all of those calls returned, even though the spots were full within, I don't know, minutes or hours, and make sure people knew that they at least were heard and know where to look for the information moving forward. So just to update you all on that and what happened with that. Again, this is not just happening in Macon County, and it's not a matter of making excuses. It's just, unfortunately, is what it is with supply demand. But just please know that we're doing everything we can to get vaccine in arms as fast as possible. Does anybody have any questions about COVID, anything?
Brandon. I have a question. I had got an email, and I think you kind of touched on it, so I think I just kind of need you to repeat that. I had an email from someone asking me about the locations to get the vaccines, and he asked if we were working with the state to increase locations. So I think you kind of hit on that. Can you just sort of repeat that so I can make sure I have that down?
Yeah, definitely. So we are doing them here in the office. Just kind of depends on vaccine supply, what days we're doing it. We're not scheduling them very far out because we don't know what we're getting that week until that week. So like we're supposed to get an email today of what our allotment is for this week. And then that allotment is split among us and then the other providers that are vaccinating. So the hospitals and the FQHCs. So they will schedule their clinics at these other sites, but there's only a small amount of the sites right now, and they'll put that out to the public. But we're vaccinating here, and then we are scheduling additional drive-through clinics, which will be announced soon. So we've asked people to watch, if they have social media, watch our Facebook, watch our website, and then we're also putting the information out to all local media sources so that whether someone watches the TV news or listens to the radio or reads the newspaper, that they would be able to see that as well. Hopefully vaccination sites will grow as we get more providers signed on, but that's something that the entity has to decide if they're going to be a provider. So we can ask everyone in the community, please sign on. If you're able to vaccinate, please sign on as an eye care provider so you can administer this vaccine. But ultimately, it's up to that entity of if they're going to do that or not. There are a lot of logistical hoops and obstacles with these vaccines. So I think that's a point of difficulty or resistance on some, like with Moderna, you have to have 10 people basically to come get vaccinated so that you don't have a wasted dose or wasted doses. And then you have to have that second one. So then you have to have a system in place to get them back there. You have to make sure you have an allotment that at that second dose time, you can make sure you get your people dosed for the second time. So I'm not sure how many more providers will sign on, but we're really hoping that we will get more in the community. If not, I know that there is initiative with the state and National Guard to supplement what communities are already doing based on what communities need that help the most. So we don't have a lot of details on that yet either, but that's kind of what they told us this morning is they're looking at who needs help the most and to supplement, not replace what communities are already doing.
Brandy, does the Veterans Administration administer those here?
I don't know if they're administering them here. I know I saw something yesterday. We're not giving them any of ours, but I know I had seen something about Danville administering over there. So I'm not sure if they're having veterans drive over to Danville. And I don't know if Kathy's on at this moment, but she may know better than I do. But I know that the Danville VA was doing their own, and we are not giving to the VA directly. So there are some entities that we give from our allotment, and then there are some that the state provides straight to those other entities.
So probably a veteran could call Danville and find out if they are giving them. I know in Chicago, yes, the VA at Hines, I believe it is. I think they are as well.
Yeah, as of yesterday, one of the people who was helping respond to voicemails had messaged that they still had some availability at the Danville VA to vaccinate. So of course that could change within hours, right. So I can't really speak to today, but it did sound to me like they were giving over there.
Hey, this is Kathy, and just to, from what I understand, yes, the VA, that's a separate allocation similar to what our nursing homes and assisted living facilities are in Macon County with the Pharmacy Partnership Program. The VA is separate from ours.
So they get a supply then?
To my understanding, they'll get the full supply, just like what we do. So they'll get the vaccine, and then they'll get all the additional ancillary supplies, like the alcohol swabs, the Band-Aids, the you name it, they'll get it all.
Do you, is it nursing staff or administration staff that you find a problem with when it's ready? Because I could volunteer if that, and I would be willing to do that if, and I don't know what the legality of that is either. I don't know if you have to be employed on site by you to give, or, but just, you can keep that in mind if you need an extra person.
Oh, Mary Jane, I won't forget that offer.
Yeah, right. You're on the list.
Okay.
Yes, and to answer your question, in case there's any other nurses listening or just anyone that wants to volunteer, we do have our medical reserve corps that anyone can volunteer for. They don't even have to have, medical background, but we do have several nurses that volunteer through that, and then people who do not have any kind of healthcare experience that volunteer to assist in different ways at some of our clinics. So anybody that wants to volunteer at this time can certainly be added to our list.
Okay.
And then another, did I cut you off? I'm sorry.
No.
Okay.
I said you can add me if you would like.
We will. Thank you.
I'm
And
It's a done deal. Done deal.
Yes, exactly. Done deal. Another thing that Kathy mentioned that I will touch on in case any of you get questions, because I know I've gotten a lot of them, is about long-term care getting assisted living or skilled nursing getting vaccinated after some of the 1B population. If you weren't aware, there is a federal pharmacy program that is providing those vaccinations. They work directly through the state and through these facilities to set up those dates. And so that is not us, and we cannot change those dates. When it comes to the long-term care facilities, we aren't even told the dates ahead of time, and we were told that that's for security purposes. They don't want for there to be a security issue or, a lot of media surrounding that, so that can be taken care of safely at those facilities. So that is not us, and that's not me, pushing it off or anything like that. I mean, they have a lot of facilities they have to get to quickly. So I'm sure, they're working through or with the state through that to get them all done as quickly as possible. But there's nothing, we have no control over that. And the allotment that they get to administer to the residents and staff in those facilities is completely separate from what we get. It comes straight off the top. It's not included in what comes straight to the health department. All right, and it looks like I think Dr. Miniganti might have a question. Do you have your hand up?
Hi, Brandy.
Hello.
Hi, good evening, everybody. How many doses have you had so far for this tier 1B? And is the supply getting better now?
Well, what I can tell you is last week our allotment was 1,400, and we haven't gotten it yet this week, so I'm not sure. They did say we should expect around the same amount each week unless something drastically changes with supply moving forward. And so,
which vaccine are they sending it to you? I mean, the Pfizer or the Moderna?
They're sending us the Moderna.
Okay, that's easier to handle.
Right, and we did get that second shipment of Pfizer for the second doses for the hospitals, and then the hospitals did get some direct shipped. So that has been used, but specifically in the hospital settings for the first and second doses.
I understand the hospitals are getting their doses for the tier 1B too.
Yes, we are allotting some to both hospitals at this time when we get it.
Okay.
And hopefully, the state said last week that hopefully this week the providers, meaning the hospitals and anybody else who signs up to be a provider, would be able to order their own and have it direct shipped, because right now it's coming here, and then we have the subcommittee that we work with, and we have to split up the allotment, and then they come pick up theirs and take it back to their facility. So we haven't heard yet that this week will definitely be the week to change that. And we know that we're supposed to get the allotment for the county. So I think we're at least in the next week before that changes, but hopefully it will soon, because that's definitely going to take away some of the logistical difficulty. And then it will be nice for the allotment just to go directly to the providers rather than the health department having to split it out each time or decide who gets what, trying to ensure that we're sticking with the phases appropriately.
Okay, thank you.
You're welcome. And Dr. Patterson, did you have a question as well?
I did. As you mentioned, the 1B group is such a large group. I didn't know if there had been any discussion about trying to reach them. I'm a little worried that the most vulnerable populations are not going to be the ones that are on Facebook or the internet, and so 80-plus-year-olds may potentially be overlooked. I didn't know if anybody talked about tiering based on age. I know I don't have any answer as to how you would do that. I'm just wondering.
This
There
is
has-
Kathy.
Oh, go
sorry,
ahead,
Brenda.
Kathy.
So
You go
I do know that the Macon County Senior Center has reached out to us about being a possible host site. And so that is also in the works of trying to set something like that up. We've even talked about possibly setting up some dates at some of the high rises. So we are, trying to, reach out as much as we can for our bases to try and get to them so that they don't necessarily have to come to us either.
And we are putting that information out, not just online, but we are putting out to local media. So hopefully if they aren't online, they would catch it in the newspaper or on the radio or on TV news. And then in addition to what Kathy was saying with, going out to the community to try to make sure that we're meeting all the populations where they are as well. The direction that we have been receiving is that we prioritize all of 1B. We don't, take segments of it or tier it. And so what we're doing is, as the subcommittee, there are large groups that have been kind of prioritized by different pieces of that subcommittee. So for example, Crossing is focusing more on the education sector. And then HSHS is helping focus on more of the business or those essential workers. And then we're taking, primarily your 65 plus, but then we're also not turning people away if they fall into that 1B group, but trying to, like I said, 1,400 doses for all entities to use in the community. Everybody gets a couple hundred or a few hundred, and those go very, very quickly. So in addition to what Kathy said, I know like the FQHCs are looking at, the patients that they have and looking at the most vulnerable, but we're not tiering them by age. We're following that guideline that says anyone in that 65 plus category should be prioritized at this time.
Okay. Thank you.
You're welcome. Any other questions or comments on any of that?
It's a lot of really good information. Thank you, Brandy, and thank you, board, for your questions. Those were all really, really good information for all of us to hear. Next up is the presentation acceptance of the financial report.
Hello, I actually do not have a report for you this month, so I just wanted to briefly talk about that. I think I mentioned last month that we were switching to new financial software. So that is in the works. Payroll went live in the new system on January 1st, and everything else went live December 1st. So currently our expenses are in 2 different systems, so it really wasn't possible without a lot of work to put everything together for a report this month. We also just got the budget transferred into the new system last week, so we are well on our way to having everything together. So by next month, I should have a report for December and January to present.
Great, thank you. Okay, review and approval of the department expenditures. And I believe these were all in our packet. Does anybody have any questions on those? Or can I get a motion and a second, please?
Motion to pay the bills. This is Vivian.
Thank you, Vivian.
This is Candy. I'll second.
And a roll call vote, please.
Paige Toth,
Approved.
Candace Clevenger,
Approved.
Vivian Goodman,
Approved.
Sue Kraus, Sue,
Sue, you might be muted.
Mary Jane Linton,
Approved.
Dr. Meningati,
Yes.
Dr. Patterson,
Approve.
and Laura Zimmerman.
Approve.
Okay, great. The review of, sorry, I scrolled away from my agenda. Do we have any grant applications
not.
for review? Okay, great.
No.
And your department division reports were in the packet, and I believe there were some supplemental ones emailed out as well. I don't know if anybody on the call would like to highlight anything, but it looks like a lot of great work in addition to COVID is going on right now. So thank you, everybody. Next up, we have employee recognition, and I will do my best not to butcher any of these names, but Becky Edwards, 20 years. That's a long time. Thank you so much. Deborah Wall Friedrich, 16 years. Cheryl Bardini, 14 years. Melissa Jennings, 10 years. Emily, who I think is on the call, O'Connell, 6 years. Jessica Pfeiffer, 4 years. Amy Schnuringer, somebody can pronounce that name better for me, 4 years. And Tina Kramer, 3 years. So a lot of long-term people celebrating anniversaries this month, and for that, we thank you. Okay, old business. Brandy.
Okay, so I think I actually prematurely pretty much covered this already. So one thing though, and this is not really old business point, but just to kind of add that I left out in COVID board education update, was we did also hold that since the last regular board meeting, we did have that drive-through clinic for phase 1A. So like you mentioned, Paige, in addition to everything that everybody's doing here as it is, there have been a lot of people that have taken on COVID duties in addition to their regular workload. And I don't know if you all saw the pictures. They were put out on social media primarily, but the team really rocked it. We had 312 vaccinations given in 6 hours. And it was raining, sleeting, and snowing that day. And the temperature dropped all day long, and we were there well into the night. And the team, everybody just had really good attitudes, and I was just very grateful for that. So I wanted you all to know, if you hadn't seen that anywhere, that went really well. So we might have gotten complaints about the phone system situation, but that drive-through clinic was amazing, and we got praise on a state call about it, and asked by a lot of other communities to get ideas for how they could do it. And we've practiced these things over the years many, many, many times, and to be able to see it come to life and actually work really well was amazing. We were able to get through 5 cars in like a 6-minute time period, and then they went to their waiting period of the 15 or 30 minutes, depending. And it just was really successful, and I was really proud of the team. And we were all really sentimental afterwards of how well it went. Of course, there's always ways you can improve, but seeing a team after they've got to be so tired after all these months step up to go vaccinate and freezing while they're doing it was phenomenal. So I missed that, and I wanted to make sure you all knew that and had seen it. And if you can't get on Facebook and want to see pictures, let me know, because they're really good ones. That's all.
And I'm going to add to that, this Friday, our goal's 500. So we're shooting for 500 this Friday.
I think we'll do it this time. I think there's going to be a lot of people showing up.
And
okay, so that's it for
this is drive-through this Friday.
Yes.
And that is for 65 and older, or that is for teachers, and what is the criteria for that?
That will be anyone in the 1B population, so anyone that fits into that. I will tell you, with Crossing doing the educators, they have started setting up appointments for the educators now, so hopefully they're going to move through that group. I think it's going to take a little while, but only because of the supply being somewhat limited, so hopefully supply will pick up. But they did put that out through the Regional Office of Education. They have already gotten people, I think it was like 600 appointments already that have signed up for that.
Wow.
All right. That's
Thanks
it
for new business.
All right. I'll hand it over to Marissa. She is going to cover that Iplan document that was sent out to you. She's just going to do a brief overview. I know that it was a very long one, and some of you have been through this before and some haven't. So I'll pass it over to her. She'll be available for any questions that you have, as am I. So go ahead, Marissa.
Hello, everyone. Good evening. First, I want to thank you guys so much for taking time to review the Iplan so that we can hopefully submit it to the state. I know that the document is long. I'm like, oh Lord, they're probably going to look at their board packet and think, oh my gosh, what is this? So, so the process of crafting the Iplan is kind of a long and challenging thing all on its own, but it has to be completed in order to remain a certified health department. And we have to do it every 5 years. Obviously, when you add responding to a global pandemic into the mix, it's made even harder. But our small little health promotions team, with guidance from Brandy and Bethany, we worked really hard over the course of several months to complete the draft to be able to submit it to you guys. So the Iplan contains an organizational self-capacity assessment, so that is where we will determine our own ability to make an impact. A community health needs assessment to determine the needs of our local community, and then the community health plan, in which we choose at least 3 health concerns to focus on over the course of the next 5-year cycle. Obviously, as a health department, we focus on a million things, but these are 3 things that we can kind of hone in on to try to make an impact. We worked with our local hospitals, HSHS St. Mary's and DMH, as much as we could. We had planned to work with them a lot more, but due to COVID and our slightly different timelines, we had to move forward in some of the processes involved in Iplan, and we continue to partner as much as we could. We took into account the perspective and opinions of our community members via a community survey. We had over 200 people take that survey. We convened a community health committee, and by the way, even with the pandemic and everybody's job roles and responsibilities and personal lives, we had like dozens of people attend this virtual meeting, and it was great to see so many agencies and organizations represented. We even saw some of you who were able to make it, and that was very nice to have your input. And then we took the opinions and knowledge of our own staff that were involved in the process to determine the top 3 priority health concerns that we're going to focus on over the course of the next year, or 5 years, excuse me. So we ended up choosing mental and behavioral health, substance use / abuse, and child abuse and neglect as the 3 priority health concerns that we heard across the board from, like I said, our community health committee, the community survey, and also kind of what we know through our work, what we see through our work at the health department, who we are personally and professionally. And we thought that those were 3 things that we might be able to obviously take things from and be able to work toward being making an impact in our community. So we determined those. We created impact and outcome objectives, and we plan to work with our community partners in a variety of ways and hopefully make a measurable difference over the course of the next 5 years. So I do want to say really quickly that I just want to thank my team and also Brandy and Bethany, who were just so involved, so helpful. With everything that went on in 2020, it would have been, maybe a little bit hard to do this just as one person, whomever that would have been. But I feel like we had just such a strong team that was willing to help and to take portions and do them, and then we would reconvene and help each other out. And it wasn't a perfect process, and it wasn't what we imagined, but we wound up with a final draft to give to you guys, and so I'm very proud of the team that worked on it. So, does anybody have any questions about the 80 pages?
I don't, but I can't believe how much work has gone into that since some of those initial meetings and some of the early on discussions that I was a part of. You guys really pulled together an amazing product. For this.
Well, thank you very much. We did have good, like I said, Brandy and Bethany both have led Iplan processes before. We had their help. We have a committed staff. I feel like that's across the board at the health department. It takes long hours to do things, especially right now, but things have to be done. And I feel like we have such a solid team and we really do pull together. And so, yeah, it's hopefully we'll be able to send it off to the state soon.
Do any other board members have any questions on the document?
Great job.
Oh, thanks. I really appreciate it. I know my team does too.
And I did just want to make sure that all board members know, and I know this is in the letter, so forgive me if I'm being repetitive, but I just want to make sure we're all on the same page. This was actually completed early so that it could be submitted to the state for a review. The advantage to doing it that way is if the state thinks there are things that we haven't done right, or they'd like it changed a little bit, or they want a little bit of an adjustment in an impact or outcome objective, that gives us a really good opportunity to make it the very best product possible. So what you're voting on tonight would be to submit this draft or approve this draft to be able to move it on to the state, and then we would get that submitted this week. And if they have any feedback, which they usually do have something, of course, then we would get those edits made and then bring that document back to you before it's submitted with our final application for certification in the summer. So I just want to make sure you all know that there could be edits. We will let you know if there are edits, but that the team did get it done early enough so we can get a nice pre-review done.
That's great. Can we get a motion to approve?
I so move.
Second, anybody?
Second.
And a roll call vote, please.
Paige Toth,
Approve.
Candace Clevenger,
Sorry about that. Approved.
Vivian Goodman,
Yes.
Sue Krause,
Approve.
Mary Jane Linton,
Approved.
Dr. Meningati,
Yes.
Dr. Patterson,
Approve.
and Laura Zimmerman.
Approve.
Great. I think we have board member appointment next, Brandy. I'm back
We
down
do.
in that major document. I gotta get back to my agenda.
So just as a reminder, we did talk about this before, that we have some board members whose terms are ending in May of 2021. And as a reminder, the process is that you all can present new board members or approve the renewal of board members whom have already been on and are willing to be on for another term. And so what happens after this, we're working way ahead so that we don't have any issues with a gap or doing anything at the last minute. So these people are all actually May 2021 terms. But I want to get them in as quickly as possible to the county. Once we approve them, they do go to the county board chairman, and he decides if he will put the appointment forth to the rest of the county board. And so then the full county board has to vote yes or no to the proposed appointments. So I know that, I've reached out to everyone and gained interest from everyone to stay on, and I can provide those names. And then we'll get, I have gotten some forms, the rest of the forms I'll get into the county as soon as possible, but we have plenty of time. We're working way ahead. And hopefully those appointments will go through, because I do feel like we have a really, really strong, committed board, and I definitely don't want to lose any of you. So I can go ahead and tell you what those names are. And then if there's any that you want to pull out as a board, you definitely can, or you can do a full approval on all. So it would be Candace Clevenger. She has said that she would be willing to stay on. Phil Tibbs, Mary Jane Linton, Dr. Meningati, and Paige Toth.
Does anyone who's not one of those people want to make a motion in full or have any comments on the?
Yeah, I move to approve all of those.
Okay.
I second.
I guess a roll call vote.
Paige Toth,
To the extent I'm allowed to vote on myself, but to the others, yes, approve.
Candace Clevenger,
Approved.
Vivian Goodman,
Yes.
Sue Krause,
Approve.
Mary Jane Linton,
Approved.
Dr. Meningati,
Yes.
Dr. Patterson,
Approve.
and Laura Zimmerman.
Approve.
Great. And we do have a closed session this evening, so Brandy, I'll let you walk us through the technical components of getting into closed session.
All right, so first we'll need a motion to move into closed, and then we would have everyone that's not a board member remove themselves from the call, and then I can work you through the IT part after we get that motion.
Sure. Motion to go to close, somebody?
I motion to move to closed session.
This is Candy, second.
Roll call vote, please.
Paige Toth,
Approve.
Candace Clevenger,
Approved.
Vivian Goodman,
Yes.
Sue Kraus,
Approved.
Mary Jane Linton,
Approved.
Dr. Menegatti,
Yes.
Dr. Patterson,
Approve.
and Laura Zimmerman.
Approve.
Goodbye, everyone. I appreciate your iPlan approval, and I appreciate you guys so much.
Okay, I think we need a roll call to get back into open session, please.
Paige Toth,
Here.
Candace Clevenger,
Here.
Vivian Goodman,
Here.
Sue Kraus,
Here.
Mary Jane Linton,
Here.
Dr. Meningati,
Yes.
Dr. Patterson,
Here.
and Laura Zillman.
Here.
Great. And now can we get a motion to keep the closed minutes reviewed in closed session closed in a second, please?
So moved, Vivian.
Second, Mary Jane.
Great. Roll call vote, please.
Paige Toth,
Approved.
Candace Clevenger,
Approved.
Vivian Goodman,
Approved.
Sue Kraus,
Approved.
Mary Jane Linton,
Approve.
Dr. Meningati,
Yes.
Dr. Patterson,
Approve.
and Laura Zimmerman.
Approve.
And if nobody has anything else, I would entertain a motion to adjourn. And a second, please.
So moved. Laura.
Candy, a second.
And a roll call vote on that.
Paige Toth,
Approved.
Candace Clevenger,
Approved.
Vivian Goodman,
Yes.
Sue Kraus,
Yes.
Mary Jane Linton,
Yes.
Dr. Meningati,
Yes.
Dr. Patterson,
Yes.
and Laura Zimmerman.
Yes.
Great.
All right.
Thank
Thank you
you,
all very
everybody.
much for your time. Stay safe. Have a good rest of your night.
Yeah, Brandy, you keep taking care of yourself and you're doing a great job. Thank you.
Thank you all. I appreciate it.